health of our community. Joining us today are Pennsylvania Governor Josh Shapiro and Pennsylvania Secretary of Health, Dr. Debra Bogen. And also we have with us Alice Yoder, the Lancaster County Commissioner. And again, thank you for joining, and I would like to now welcome Governor Shapiro to the podium.
Thank you, Mr. Barber. I appreciate you welcoming us here today. I also want to thank Dr. Jeffrey Martin, the chair of the Department of Family and Community Medicine here at Penn Medicine Lancaster General Hospital, and of course, our great health secretary in the Commonwealth of Pennsylvania, Dr. Debra Bogen, who you will hear from in a few moments. I'm here at Lancaster General today to provide an update on the ongoing measles outbreak across the Commonwealth of Pennsylvania. This is a serious and a growing problem across the country and right here in our Commonwealth. So far this year, there have been 393 confirmed cases of measles in Pennsylvania. That is the highest number of measles cases since 1992. Nearly 20% of those cases have resulted in someone being hospitalized. It's important to note that every single one of those cases was someone who is not fully vaccinated. And just this morning, the Pennsylvania Department of Health announced the first 2 measles-associated deaths in Pennsylvania in 35 years. Both of the individuals were from Lancaster County, and both were unvaccinated. We hope and we pray that those deaths will be the last. I want to be clear, this illness and death from measles is completely preventable. We already have the tools to protect ourselves and our families from this disease, which is one of the most contagious diseases on the face of the earth. I want to explain for a moment just how contagious measles is and what we can do to protect ourselves. Let's start with how you contract measles. Measles is an airborne virus, which means you can catch measles just from being in the same room as someone who already has it. Let me give you an example. If someone with measles walks into a room with 100 people in it, none of whom are vaccinated, 90 of those people are at high risk of walking out with measles. If that same individual with measles walks into a room of 100 people who are fully vaccinated, the only person walking out of that room with measles is the person who walked in with it. The vaccine is the best tool we have for preventing the spread of this disease. And let me be clear, this disease does not respect county lines or religious lines. It goes after all who are unprotected. Here in Pennsylvania, this outbreak has now spread to 28 different counties and made up of different populations, people of different faiths, and people of different kinds of communities. The people impacted are registered to different political parties, and they come from different walks of life. Thanks to science, we have a vaccine that can keep us safe from measles and provide a lifetime of protection. And when more than 95% of people in a community are vaccinated against measles, that effectively prevents the spread of the disease in its entirety. That's really important to protect the people who can't, it is really important to protect all the people who can't get vaccinated. People like newborns who are too young to receive the vaccine, or people with health conditions that prevent them from getting vaccinated. We all can do our part to protect them. Under Dr. Bogen's great leadership, the Pennsylvania Department of Health has taken significant strides to protect our communities and stop the spread of measles. First, they made a lot of factual information available to doctors and families about this disease. You know, measles has been so rare for so long that many doctors don't know a lot about it. Dr. Bogen and her team have worked to inform physicians of the symptoms so they can tell the difference between measles and some other illness, between the rash that appears from measles and perhaps some other rash. They've also made reliable information available from sources that you can trust, available online for anyone to be able to read up on it. And they've made data about measles vaccination rates in our communities available to the public so that families can be better informed. Second, Dr. Bogen's team has worked hard to make vaccines available to the people who need and want them. So far in 2026, the staff at the Department of Health have administered more than 4,100 MMR vaccines across the state. They have held 91 different pop-up vaccination clinics, and they've given more than 1,000 doses of that vaccine to our neighbors right here in Lancaster County. And the Department of Health, under Dr. Bogen's leadership, has more than 40 additional clinics scheduled this week and in the coming weeks. I want to say how grateful I am to the moms and dads and to the business owners, community leaders, religious leaders, and others who have opened up their churches, their community centers, even their private homes to our vaccine teams who are there to administer this life-saving vaccine. Neighbor, looking out for neighbor, helping more Pennsylvanians get protected from this disease. That's the Pennsylvania way. That's how we do it here. And I believe we are making some progress. Consider this. In a typical month, all healthcare providers, the Department of Health, along with other medical providers across Pennsylvania, typically administer about 25,000 doses of this vaccine. In the last month, providers across Pennsylvania administered 35,000 doses of this vaccine. Pennsylvanians are now stepping up, and I want to say thank you, and I also want to let you know we need to keep at it. We're not out of the woods yet. Look, I'm obviously here as your governor talking about a really difficult topic, but I'm also thinking about this every day as a dad. Laura and I are blessed with 4 children. And as a dad, the most important job I have in life is to protect our 4 children. All I want to do is keep them healthy and keep them safe. I take concrete steps to do that every day. I pray for that every day. And I want to use every single tool at my disposal as a dad to protect them from anything bad that could possibly happen to them. I think about that feeling a lot when I sit with Dr. Bogen or sit with our team and consider this challenging moment that we find ourselves in. Because as your governor, it's my job to try and keep everyone safe, make sure they get the information that they need. They have access to accurate information so that they can make the best choices for their families, so they can do their best jobs as parents to protect their children. I recognize that making choices about your child's health in today's world, with a constant flow of information and misinformation from lots of different sources, it makes it even more confusing. It produces a lot of anxiety. All you want to do is protect your kids, and you're taking in this information, and you want to make sure that you're doing what is best for them in the short term and in the long term. I get that. I also get that as parents, every day we're getting all kinds of different opinions from all kinds of unsolicited sources about what we're doing right and what we're doing wrong and what others might do differently. I know firsthand how that can make you feel. And I've heard from so many parents about how that can make them feel worried and anxious. I get that. I understand. Parents are getting inundated with information on social media, some that's really reliable, factual, and a whole lot that, quite frankly, isn't. And let's speak truth for a moment. Folks are spreading skepticism about things like the MMR vaccine without any evidence to back up their claims. That scares a parent who's just trying to do the right thing by their kids. And it plays a role in why so many people right now are getting measles for the first time in decades. When the information we see coming from the federal government in some cases isn't driven by facts and by science, it makes it even more confusing for parents. And that has a serious impact. Because as I said a moment ago, all we want to do as parents is what's right for our kids. We don't want to do anything that could possibly impact them in a negative way. But we're seeing that this misinformation is taking a real toll on a parent's job to protect their kids. We see it in the data right here in Pennsylvania. The rate at which families are now citing philosophical or religious exemptions from getting vaccines, that has tripled in the last 10 years. The data bears this out. And what does that mean? It leads to lower vaccination rates, and it has dramatically reduced community immunity. Some people refer to this as herd immunity in different areas of our Commonwealth. Today, we see the consequences of a lack of immunization in the first measles-associated deaths that our Commonwealth has seen in 35 years. To put a finer point on this, if 95% is that community immunity rate that we want to hit and exceed, here in Lancaster County, just 87% of all incoming kindergartners are fully vaccinated. Down the road in Montgomery County, 95% of kindergartners are fully vaccinated, and the Department of Health can provide data on each of our counties. Look, I'm not here to tell people not to read what's on the internet, or not to listen to your friends or neighbors, or not to consider your own feelings before making these decisions. Parents absolutely have the right to make their own decisions on how to best protect their kids. But it does require us to sort through the noise and to figure out which information we can trust so we can best protect our children. So I guess what I'd ask of every parent in Pennsylvania, because I do believe that you want to protect your kids just like Lori and I want to protect our 4 kids. Please take in all the information you can, consider it, process it, and then go speak to an actual trusted healthcare professional to digest that information, to learn from it before you make a decision, before you decide how to proceed. Every parent knows we can't protect our kids from everything. Despite how hard we try, there aren't a lot of guarantees in life. But right now, while measles is spreading rapidly here in the Commonwealth of Pennsylvania for the first time in over a quarter century, this is one thing I'm counting on as a dad. If you're fully vaccinated, you're not getting the measles. The vaccine is highly effective. It is the best way to protect yourselves, to protect your kids, and to protect our communities. Here in Pennsylvania, under the leadership of Dr. Debra Bogen and her team at the Pennsylvania Department of Health, we're doing everything in our power to support our families with the information that they can trust, to track cases and keep our communities safe, to partner with our healthcare providers here in Lancaster and all across our Commonwealth, and to help people who choose to get vaccinated to do so quickly in their neighborhoods. For more information about the steps we've taken and the steps that we will continue to take to keep folks safe and healthy here in Pennsylvania, I now want to turn it over to Dr. Debra Bogen of the Pennsylvania Department of Health. Dr. B.
Well, good morning. Thank you, Governor, for your leadership and commitment to protecting the health and communities across Pennsylvania. I stand before you with a heavy heart to discuss news that no public health official and no physician ever wants to deliver. As you heard the Governor say earlier today, the Pennsylvania Department of Health reported that 2 Lancaster County residents with measles have died. Out of respect for their privacy, we will not be releasing additional personal details. Protecting the confidentiality of residents is a core responsibility of the Department of Health. My deepest sympathies go out to the families, friends, and communities who are mourning the death of these residents. We're here today to get accurate and actionable information to the public. There has been an ongoing measles outbreak in Pennsylvania since late April. And so far in 2026, as the governor said, the Department of Health has confirmed 393 cases, roughly half of them here in Lancaster County. And the department is working with partners across the entire Commonwealth to respond. Just like we did decades ago, we can prevent the spread of measles, but it takes all of us now working together to do that. Our teams are working 7 days a week to reduce the spread by 1, overcoming barriers to vaccination, 2, providing education to individuals, communities, and healthcare providers, and 3, continuing to conduct interviews and provide guidance to those impacted. The most critical step we can take is making sure that those who are not currently protected receive the measles, mumps, and rubella vaccine, also called MMR. Measles is a highly contagious airborne virus, but we are not powerless against this virus. The MMR vaccine is backed by decades of research and real-life, real-world proof that it is the best way to protect you and your family from measles, providing 97% lifelong protection after 2 doses. For the vast majority of our neighbors, protection is already in place. Based on our data from the 2025-2026 school year, more than 93% of Pennsylvania's kindergartners, more than 94% of 7th graders, and more than 96% of 12th graders received both doses of the MMR vaccine. And because the majority of our students are fully vaccinated, many of our schools benefit from robust community immunity that serves as a powerful shield against this virus. The overall risk remains low to measles, especially for those who are fully vaccinated. To date, all people with measles confirmed by the department were not fully vaccinated. Because the MMR vaccine essentially eliminated measles here in the United States decades ago, people have forgotten how serious it can be, especially for the very young, the pregnant, and the very old. During this outbreak, we have seen that when measles reaches a community, the interest in getting vaccinated increases. But we know families often have questions before they seek a vaccine, and actually it's really important that we welcome those questions and answer their questions. We want to have meaningful conversations so that everyone can understand and be confident in the protection available through the vaccine. Public health is about providing accurate information and support to help you make the best decisions for you, your family, and your community. If you or your children are unvaccinated, we encourage you to reach out and have a discussion with your trusted healthcare provider. You can also visit one of our 59 state health centers to learn more about measles and about how to get vaccinated. We're here to answer your questions without judgment and ensure you have access easily to vaccines in your communities. Beyond increasing vaccinations, we also want to empower our healthcare providers, our school leaders, and residents with research-backed information about measles. Earlier this summer, we expanded medical education for healthcare and public health professionals through medical briefings, health alert notices, and sharing resources to help them quickly diagnose and treat measles, with more outreach planned in the coming weeks. With the new school year beginning, we partnered closely with the Department of Education, school administrators, and school nurses, including recently sending a letter to all schools explaining how to identify and respond to measles. And just last week, nearly 1,000 Pennsylvania school nurses attended the Department of Health measles briefing to prepare for the school year. We also launched a new school vaccination resource tool, allowing everyone to see their school's vaccination coverage and make informed decisions. We provide extensive resources about measles on our website at pa.gov/measles. Here in Pennsylvania, we have a strong sense of community and a proud tradition of looking out for each other. Right now, nurses, doctors, and public health workers are doing everything they can to protect your health and stop this outbreak. The Department of Health is here to support you and your family and to make vaccines access easier for everyone. I want to take a moment to just say how truly grateful I am to all of the collaborations and partners across the Commonwealth who are responding to this outbreak. This is a team effort. People have opened their doors and hearts to ensure all Pennsylvanians have access to vaccines and information. So again, thank you to all of our partners. And it's now my honor to welcome Lancaster General's Dr. Jeffrey Martin to discuss what local healthcare providers are doing to stop the spread of measles.
Good afternoon. Governor, Secretary Bogen, elected officials, and my healthcare colleagues. It's great to see so many faces that I know in the room. My name is Jeffrey Martin, and I work for Penn Medicine, Lancaster General Health, and I've had the privilege of living and practicing family medicine in Lancaster County for over 30 years. As a healthcare provider who last saw measles as a medical student over 30 years ago, these tragic deaths remind us that measles is not a harmless illness. Our focus now must be on the families who have suffered unimaginable loss and on the steps we can take together to prevent additional illness and death in our community. First, one of the most important practical messages that we can share is if you think you or your child might have measles, or if you've been exposed to someone with measles and are experiencing symptoms, please call ahead before seeking care at your respective healthcare location, whether a hospital, urgent care, or clinic. Calling ahead allows healthcare workers and teams to prepare and arrange for safe evaluation, minimizing exposure to others, and protecting vulnerable patients who may be in waiting areas. This simple step can significantly reduce the risk of spread. At Penn Medicine Lancaster General, to quickly find a number for our emergency department, urgent care, or outpatient clinics, you can call 717-544-5941. Secondly, as the new school year begins, families are focused on the excitement that comes with it. Children are meeting new teachers, making new friends, and returning to routines that help them learn and grow. At the same time, our community is responding to a measles outbreak that reminds us of an important truth, that our health is interconnected. It's appropriate that we're having this press conference at our Women and Babies Hospital. Pregnant women and children are vulnerable to measles if they are not vaccinated. Infants cannot receive the vaccination until 6 months of age. People undergoing cancer treatment right across this parking lot at our cancer center are also vulnerable, as are people with suppressed immune systems. They are not just our patients. They're our neighbors, our friends, coworkers, classmates, and family members. One of the things I love most about Lancaster County is that we understand the importance of community. We show up for one another in times of need. We deliver meals. We support each other during times of illness. We care for our neighbors. Vaccination is another way we care for one another. Yes, it is a personal health decision, but it also has a community impact. When enough people are vaccinated, we create a protective barrier around those who cannot protect themselves. In that sense, vaccination is not only about self-protection, it's an act of compassion. As physicians and healthcare professionals, we have seen firsthand the power of vaccines to prevent suffering. We have also seen, and today, heard in stark terms, the consequences when preventable diseases return. The good news is, as you've heard, that measles is preventable. The MMR vaccine is highly effective and has protected generations of children and adults. It remains one of the safest and most important tools we have to keep our communities healthy. Today, I encourage families who have questions to speak with their healthcare provider. We welcome those conversations. We want people to have accurate information and to make informed decisions based on evidence, science, and trust. Most importantly, I encourage all of us to remember that public health is ultimately about caring for one another. The strength of a community is measured not by how well it protects the strongest among us, but by how well it protects those who are most vulnerable. That has always been one of Lancaster County's greatest strengths. If we continue to look out for one another, support one another, and take steps to protect one another, we will get through this outbreak together. Thank you. And now I'd like to invite Governor Shapiro back to the podium for questions.
Thank you, Doctor. Dr. Martin, thank you for your thoughtful comments. Dr. Bogen, I'll do our best to answer some questions from the media.
Hey,
Joe.
my question is actually for Dr. Bogen. So why can't you say how old the deceased people are? Aren't children more at risk for death from measles? And do these deaths change the state's calculus on controlling the outbreak?
Thank you. We are protecting people's privacy and confidentiality. This doesn't change what we do. The message and the importance of vaccination, our message remains: get vaccinated, get the information you need, and sharing additional details will not change our messaging and our outreach.
But doesn't it change if children are dying from measles, doesn't the public deserve to know that?
Again, this is about patient confidentiality, and our response is not changing. Our public health efforts are the same. We have put out guidance about early vaccination starting at 6 months, and we have continued to put out more and more information about how to stay healthy, and we are asking all of you here in this room to get that message out.
Barbara, ABC 27, go ahead.
Thank you for your time. Talk about, you've been saying this, we've covered a press conference in Lancaster, I think just about a month ago. Is the message not getting through to a segment of society to get vaccinated? What can you do? Is there other methods to try to get through to people to get them to feel comfortable getting vaccinated?
I think what you've seen in recent weeks is an uptick in the number of people getting vaccinated. And I think that's largely due to the leadership of Dr. Bogen to quietly and methodically work with communities to set up vaccination clinics in local churches or local homes, community centers, and to engage in a respectful dialogue, one where trust can be built, where actual facts are shared from real medical professionals, a real expert in science serving as a health secretary. And as a result of that, you are seeing more people get vaccinated. As I mentioned in my comments earlier, roughly 25,000 people a month were getting vaccinated by all health care providers, not just the Department of Health, inclusive of the Department of Health. And that number has jumped to about 35,000. So we appreciate the public's assistance. We appreciate the community spirit that Dr. Martin spoke about, and we're beginning to see more and more people get vaccinated. And of course, having this vaccination prevents you from getting measles.
Over here.
Can you tell us if either of the two people who died were a member of the Amish community, and was it a baby, a stillborn, a mother, a pregnant mother?
Look, I think Dr. Bogen has made clear, both due to our laws and to a respect for individual privacy, that information is not going to be released. But to the broader point of your question, and I appreciate what you're asking, measles has now been traced to 28 different counties that have really different makeups, both from a religious perspective and from a broader community perspective. It would not be fair for anyone here to conclude that this is just a problem in one particular community. This is all across our Commonwealth. When I say you, I'm not in any way disparaging you asking the question, but I want to make the broader point here that this is impacting us all across the Commonwealth.
Tom, Governor.
Hi, Tom.
Hey, I know the federal health secretary made some comments that religious groups were often involved in these outbreaks. Are you worried that there could be some maligning of groups?
I do.
The plainclothes community or otherwise. And more importantly, what else can you do beyond just get to the podium and tell people this is the best way to protect you and your family?
I do worry about the U.S. Health Secretary or anyone else maligning a particular community or neighborhood or county in Pennsylvania. And it goes back to the answer I just gave to your colleague. Part of the reason why I was late is I've been sitting out in the parking lot talking to Secretary Kennedy, who reached out to me this morning. And while I appreciate his willingness to offer staff to assist us. We think we're able to manage this through the Department of Health. I was very, very blunt with him, and I made very clear that his actions and the rhetoric that's coming from this administration are having a negative impact on communities across America, particularly right here in Pennsylvania, that there's real life consequences to spreading misinformation. There's real life consequences to scaring people and not relying on actual doctors and actual medical professionals to provide unbiased information to parents so that we can make reasonable decisions for our kids. As I said before, look, people are trying to do the best for their kids. They're trying to protect their kids. And the best way our health experts at the federal level and the state level and in a hospital, wonderful hospital like this, the best way those professionals can do their jobs is to provide unbiased, factual information so that parents can make responsible decisions for their children. Sharing conspiracy theories and misinformation does not help the cause of public health. And it leaves people less healthy and less safe, and it leaves parents in a position where it's harder for us to do our jobs to protect our children.
James, go ahead. As for the future of this disease, many of the schools in the tracker with lower vaccination rates are here in Lancaster County. How concerned are you and Dr. Bogen that the start of the school year may exacerbate this measles outbreak?
I'll let Dr. Bogen speak to that. I will tell you that Dr. Bogen and Dr. Rowe, who leads the Pennsylvania Department of Education, have been working very closely with school districts across Pennsylvania to both answer their questions and arm them with helpful information that they need in order to keep their school community safe.
Yeah, we have been meeting and making sure that the schools have all the information they need. So we sent an introductory letter to make sure that people had the tools that they need to respond if there's a case in their school. We're working with our school nurses. We have our epidemiology team answers questions when they call. We are in contact with school nurses across the state. So the schools are prepared and have all the tools they need, and we will support them if there's a case, and we will do our work that we do quietly all the time to respond to cases.
Has there been direct outreach to some of the religious schools, the Mennonite schools? Some of them are below 50% in the tracker.
We have sent the letter to every school in the Commonwealth, and we'll continue to work with the nurses in those schools as well.
Thanks, James. Steve, real quick, we gotta wrap, guys.
Dr. Bogen, we've talked a lot about children today, but would you also be advising older Pennsylvanians, particularly those who are born between 63 and 67, to get the MMR booster? And how important would it be to have a full-throated endorsement of the vaccine from Secretary Kennedy?
So just to remind people that you are very, very protected if you have 2 doses of vaccine. So check your vaccine records. If you're not sure, check with your doctor. If you were born before 1957, you are fully protected. And for those in between, I would encourage them to check with their healthcare provider. Many people who were born between 1963 and 1967 probably already had a booster vaccine. So again, you don't need a booster if you've already been vaccinated and you have 2 doses. You're protected.
Thank you, Steve. Thank you, everyone.